Wes from NewFrame here. I think most of us at this point have ran into a situation where their physician has been quite the annoyance. If you're watching this video, you're probably tired of waiting weeks for doctor's appointments to only be talked down to and casted aside during the visit. Well, what we found is that this frustration with your physician can significantly impact your pain. So in this week's Outgain Your Pain video, we're going to cover different ways you can build and foster a better relationship with your physician or healthcare provider. We can probably guess why you're frustrated by your doctors. Let me guess. It's probably one or several of the following. They either don't spend enough time with you, they don't give you anything you can work on at home, they don't listen to you, they don't believe you when you tell you your symptoms. That's a big one. They don't acknowledge any of the work or research that you've done at home, or they don't answer any of the questions you have at the end of the session. And how do we know this? It's because we've heard it all before. What it boils down to is them not meeting your expectations. So what do we need to do? Well, we need to set those expectations at the beginning of the visit. But that's not all. In this video, we're going to tell you exactly what you need to do, breaking things down into things you can do before the session, during the session, and after the session with your physician. Now, we realize this topic can get you riled up pretty quickly, so we want to make sure and make a quick note to say when you're talking to your MD, be sure to distill empathy. Because even though doctors seem like these larger-than-life individuals, they're still just human beings. And they have huge demands put on them. I'm talking a lot of doctors see close to 20 people in an 8-hour day. That's a lot. And this is why they're often either running late to your appointment or spend only a little bit of time with you. Because they might be out of gas, or they might figure they can give you a quick solution to your problem and move on to the next person. Now, I don't want to make excuses for doctors, but they aren't perfect, and they may not be totally sure what's going on with you. And this is why it's paramount to talk to them with empathy and love, because if they're stressed out themselves, it'll be hard for them to effectively help you. Okay, let's now talk about what to do before the visit to your doctors. This is going to include writing a lot of things down, so get ready. And this is important because we can often get a deer in headlights sensation when talking to these individuals because they're supposed to have all the answers to our pain. But by writing things down, we will have effectively created a game plan for your next doctor's visit. But what should you write down? Well, for one thing, you want to write down all the questions you have about your pain and current situation. Here, I'll give you a few examples. One example could be, why am I having pain? What can I do at home? Are there any medications that can help? Is there any other type of healthcare professional you recommend, like, a physical therapist, a psychologist, nutritionist, or another specialist? What's your plan for my care? Is there any imaging or tests that should be done? What are your probable diagnoses? And this list could literally go on and on. The questions you ask will greatly be dependent on your exact situation. So get out the pen and paper and start writing down all the questions you want to make sure are answered. Another big thing you should have ready for your appointment is a list of medications you're currently taking. This is always a lifesaver when I see people in the clinic. You see, each place you go will have their own system for documenting, something we like to call an EMR. These EMRs aren't set up to talk to each other because the software is wildly different. This means we can't necessarily see all the notes from your previous providers, including your list of medications. Now, this is getting better, but it still has a long way to go. If you have all your medications listed out, and bonus points if you have the milligrams of each one you're taking, then it gives more time for your physician to talk about the things that are more meaningful to you. You know how we said that healthcare providers can't see all the other doctor's appointments? Well, this is why physicians, therapists, and other healthcare workers will often ask you to explain your entire situation, which when they're listening and willing to spend time with you, this is a good thing. But however, if they're in a rush or trying to hurry you along so they have time for the next patient, it could be not such a good thing. What my recommendation is to write out your entire story, from start to where you are now. For some, this might be a super long document, but at first, don't hold anything back. Write down every little detail you can think of. Then, once you can't think of anything else, save your work and put it aside. After a day or two, revisit your story. Now we're going to try to whittle things down a bit. You want to focus on the major details, like when you start having pain, when you were diagnosed with any type of condition, any type of imaging that's been done, your biggest struggles in terms of activities you have difficulty performing, your level of fatigue, the level of brain fog, etc., etc. And then write out a second story with these details. This will probably be the one you say to your doctors the next time you see them, but be sure to bring both. I know that it seems like a lot of work right now, but it will really streamline the process when you're at the appointment with your doctor. Okay, so the day has finally come. You're at your appointment, and best yet, you're ready. So you get into the office, the nurse takes you back, measures your height, your weight, maybe takes your blood pressure, and the next thing you know, you're sitting in the treatment room waiting for your doctor. What to do next? Well, that's what we're going to go over in this next section. When your MD finally comes in, sits down, and starts talking to you, one of the best and most impactful questions I found is asking how much time they have to work with you. Like we said before, doctors are under high demand and have a bunch of people to see in a day, but most want to make sure you get something valuable out of seeing them. So in the beginning of the session, just acknowledge that you're not their only patient and ask them, how much time do we have together today? This will not only set the tone for the session, but also with you acknowledging that you're not their only patient, they'll actually spend more time with you. Also, in the beginning of the session, be sure to mention you have questions you'd like to ask. That way, they'll know what to expect during the treatment session. I know it may sound really simple, but these are the small things you can do during your session to make it work the best in your case. Now, they'll probably want you to explain what brings you into their office, and this is where you want to bust out your written story. I'd start off with the shortened version of your story you previously wrote, but if doctors say they have a lot of time, then bring out the long one. After this, they'll probably give some recommendations based off of what they've seen during the session. This is what we like to call establishing a plan of care. And here's where you can start adding some questions yourself. Not questioning their line of thinking, because then they'll end up just getting defensive and shutting down, but just seeking to gain a little bit more understanding to what their thought processes are. I would even recommend writing notes as they're speaking, then at the end, asking some clarifying questions and repeating back to them your understanding of what they told you. After they tell you what they feel is going on, jump into the questions you wrote down before the visit. Since you mentioned that you'd like to ask some questions during the session, they won't feel thrown off guard at all. Hopefully, some of those questions were answered during the session, however, and undoubtedly there will be a few that weren't. So, take a second to scan your list of questions and ask any and all that weren't answered. Okay, at this point, you should feel pretty good about the visit. If you're not, the provider was probably being a little too vague for your liking and not effectively answering any of the questions you had for them. If this is the case, it's sometimes because they don't have a clear picture of what's going on for one reason or the other, or they feel uncomfortable guiding your care. And if this is the case, don't be afraid to ask for a referral to another specialist, or even ask if they have anyone that they would recommend for a second opinion. I don't know if you know this about me, but I have ulcerative colitis, which is an autoimmune disease that attacks the lining of your large intestines. Let's just say there was a snag in my treatment, and one of the many things I most respect about my GI is that he was able to recommend me seeing another specialist for a second opinion, and I didn't even have to ask. He recommended it. I don't want to tell my entire story here because it'll take too long, but I ended up having a consult with another doctor, got the answers I needed, then went back to my GI, whom I'm still with today. It was a great and overall really fruitful experience. Now for the things to do after the appointment. First off, make sure you have a follow-up appointment with your physician, and I highly recommend doing this even before you leave the building. Also, your healthcare provider probably recommended that you go see either another specialist or get some imaging done or maybe have some additional tests ran. And one of my biggest pieces of advice is don't wait around for a phone call from the place you're being referred to. If a week goes by and you don't hear anything, call the place directly. You'd be surprised about how many times things fall through the cracks in the healthcare system, so be sure to advocate for yourself. Call them directly, and if they say they didn't receive an order, contact your doctor's office and have them send over another one. In healthcare specifically, the squeaky wheel tends to get the grease. Well, that should just about do it for today's video. However, I want to leave you with one more little piece of advice. If you're ever in the situation where you need to find a new specialist or, get a second opinion, here's a few steps I recommend you following. First off, ask around. Your friends, family, even online communities can have a professional that they recommend because they've seen them before and had success. If they do, check them out. It's an excellent place to start. Another option is to talk to your primary care physician. They probably send the most referrals compared to any other doctor and would be a great person to ask. Also, if you're currently seeing another type of healthcare provider, like a psychologist, physical therapist, chiropractor, etc., be sure to ask them. They usually have the inside scoops on the most effective physicians. Finally, be sure to check online. The great World Wide Web is a great wealth of information. And there are heaps of websites out there that were made specifically just to rate doctors and MDs. But be a little careful here though. A lot of the time, only the people who've had one or two bad experiences will write a review. So don't let that one or two bad reviews skew you away from seeking out that provider. And that should be the bow to put on the top of this topic. If you have any questions or want to learn more about what NewFrame does, be sure to check out www.newframeyourpain.com for more helpful guides and more resources. And if you have questions, please leave a comment down below. But that's all for now. Until next time, take care.